My name is Stefano Checchi. I'm a dental hygienist from Italy. I'm a clinician and I'm enthusiastic and proud user of the technology from Mectron. More in detail of COMBI Touch by Mectron. COMBI Touch is an exclusive devices that combine together and put together different kind of technology. From one side of the unit we have a fantastic and state-of-the-art piezoelectronic technology. That means power scaling for different kind of procedures, and on the other side of the unit we have a double system for air polishing. Mectron is manufacturing the COMBI Touch since several years by now, and now they are launching a new version of their devices, a most advanced and innovative evolution of the COMBI Touch that feature a lot of details, a lot of innovation that can bring another piece of evolution in terms of prophylaxis and clinical application. So let me introduce to you step by step the innovation that Mectron brings in this new version of the COMBI Touch. And let me start from the power scaling side of the units. So on the white touch screen we can find several different kind of function mode. So we have endo, we have perio and scaling, and we have restorative. According to the different function mode, the unit itself brings to the handpiece and on the working ends assembled on the handpiece the proper amount of power and the proper kind of vibration of the tip itself. So according to the different clinical needs and according to the different kind of clinical treatment that has to be done, we can use the units for several kind of procedure. And this is something that can really be effective working in a large team in a dental office. The units feature this very large, white and high-tech touch screen. And on the screen here is reported every single section of the functional of the unit. So we have the ultrasound area, we have the setting of the power, the setting from light irrigation, and then we have the section dedicated for the air polishing with the perio, the prophy, and the function for refill, the powder chambers, and for flush, for taking care and maintaining the functional of the units. Every single aspect of the unit is controlled just with the gentle pressure of the fingertips on the touchscreen. Every time we switch the unit from off to on, the on-off button is here in the back of the units. The units itself run a self-diagnostic cycle. That means a self-evaluation of every single kind of electronic component that is inside the units. And that is very useful in order to assure to the clinician that the unit is ready to be used and in order to realize very effective and very safety clinical procedure. Each function mode has got its specific operative parameters, and the unit itself is set to provide the specification for every single kind of selection, in terms of power or in terms of kind of vibration of the working ends assembled on the handpiece. But of course the clinician can adjust the level of the power, for example, and here in this area of the touchpad we can find the power setting column with different setting elements. So we have the number 1, so that means the lower power, or 2 or 3 since the last number of the power, that is mean 5, maximum level of power provided by the units. Of course we can also modulate again the kind of vibration of the working hands thanks to a specific function that is called soft mode. The soft mode is available for the perio and scaler in order to reduce the amount of kinetic energy released on the teeth surfaces that reduce in a very significant way the effect of the pain due to the contact between the working ends during the vibration and the dental elements. So this is something that is really comfortable for the patient. Concerning the ultrasound piezoelectric section of the unit, of course we need irrigants, we need irrigation, especially for perio and scalar function mode, and of course for restorative function mode. The unit itself is set to have several options of the source of irrigants. The first one is here in this area we have an individual, a separate irrigant tank, is 500 milliliter containers. And of course, when we select to use this kind of source, we have to select and press the button here in the irrigation area. And of course, there is the logo, the icon of a small bottle here, and selecting this one, we select to use the irrigant that is contained in this tank. And of course, we can adjust the amount of water that will go out from the terminal working ends according to the specific needs with the plus or minus button here. The second source of irrigants is the standard water line from the dental office that can be connected here in the back of the units. Of course, for the water line that came from the dental office, we can adjust, of course, the amount of water using this very practical and useful adjustment button here. So we can turn left or turn right in order to adjust the level and the amount of water that came out from the handpiece. Dedicated to the ultrasound piezoelectric technology, Mectron designed more than 40 different working ends for the handpieces. The different kind of insert are compatible to both the different kind of handpiece, the standard one or the slim version of the piezo handpiece. Of course, every single tips comes with this plastic wrench that is very practical, very useful to assembling and to removing the tips from the handpiece itself, and of course host the tips during the sterilization and the procedure of managing the tips after the clinical application. On the right side of the unit, we have the double air polishing system. One section is dedicated for supragingival treatment with the indication of prophy. The second one is dedicated for the treatment of the subgingival area or around crowns, restoration, implants, and so on. And this function is called perio. When we select on the touchscreen prophy or perio, the units adjust automatically the amount of water, powder, and of course the amount of compressed air we are going to use with the air polishing handpiece. That is really important in order to treat the different area according to the specific feature of the tissue or the area of the cavity we are going to treat. And of course, in order to prevent trauma on the tissue. So for supragingival, we have a 3.5 bar of compressed air, and of course for the perio air polishing, we have a reduced amount of pressure, so that means 2.8 bar, so bar. For the two different operative mode, prophy and perio, we have separate powder chamber, and this is really essential. It's really exclusive for this kind of devices. So we have the prophy chamber, and we can place inside the specific powder dedicated for supragingival treatments, such as bicarbonates or calcium carbonate. Or in this section we have the perio powder chamber, so we can fill in this chamber with glycine or in any case powder dedicated for subgingival treatments. Refill the two chambers is very easy, very practical. There is a button here to select that is called refill. Pressing the refill button, the unit itself evacuate all the compressed air, depressurize the powder chamber so we can easily to remove it, to open it, and to refill with the proper kind of powder. According to the different selection, prophy or perio, the units is set itself in order to provide the right amount of compressed air, powder, and water. But of course, if you want to adjust the amount of water, we have another element here just on the bottom side in the front right side of the unit that we can turn left or turn right in order to reduce or increase the amount of water that came out with the compressed air and with the powder. And concerning the air polishing handpieces, this is the second biggest innovation in the new version of the COMBI Touch, the handpiece. The handpiece is similar to the one described for the piezo technology. So again, is very, very thin, very slim, is really and longer, and of course is really practical in order to grasp in order to allow the clinician to reach the most posterior and difficult to reach area in the oral cavity. The different handpieces available for the COMBI Touch mectron are three. The one is, this one is 120-degree curved in the very terminal working hands. Then we have another one that is bended at 90-degree, and these two handpieces is really dedicated for the supragingival application and of course for prophy. But of course we can also use with the perio when we use the handpiece and the proper powder on the surfaces of implants, orthodontic appliances, devices, etc. Then of course we have a dedicated handpiece for subgingival activity. So when we select perio, we need to assemble the handpiece corresponding to the perio function, and of course is designed to grasp on the very terminal working end a single use, a disposable silicone nozzle that is really effective to reach the deepest area in the pocket defect in the periodontum or in the different area subgingivally. Assembling or disassembling the handpiece, the slim version of the air polishing handpiece, is really easy. It's just a matter of pull and push, and again it's very easy to remove or to assembling it again. And of course the unit recognizes when we put in the proper dot the handpiece, so in that case the unit is switched off. When we pull out, is switched on. Concerning the air polishing section of the units, Mectron COMBI Touch brings something that is really exclusive. That means a flux of air, compressed air, comes from the units across the cable, across the tube here, and reach a handpiece and came across the working ends when the handpiece is in standby mode. That is because the units prevent the clogging of debris inside the handpiece, and of course avoid the clinician to spend and to invest time in order to managing or to removing every deposit inside the handpiece. Last but not least, in terms of importance, dedicated for piezo and also for the air polishing section of the unit, we have a specific function that is called flash. Selecting the flash button on the touchscreen and press the pedal, when we release the handpiece here with the flash mode, a certain amount of water came across the units from the cable to the handpiece from the tips in order to remove every kind of contaminants that can remain on the top of the units, and that allows the inner side of the unit to maintain cleanliness and of course a perfect condition in terms of hygiene and cross contamination prevention. Same things for the air polishing. So when we finish to use the handpiece and the prophy chamber, doesn't matter if prophy or perio, we can select the flash function, of course, press the pedal and activate the function, and a certain amount of water and compressed air came across the unit to the cable to the handpiece in order to remove everything from the inner side of the devices, and that keeps the unit really clean and ready to use. And we can perform this kind of flash mode activity at the very beginning of the working day as a preventative procedure, and of course we can do and repeat this procedure every single patient between the different patients. COMBI Touch by Mectron can be also connected with an external unit. This one is called Ozoactive and is an ozone generator unit. The units generate ozone starting from the air and the electricity, and of course the gas produced is reported here in the specific connection tubes and of course related to the units. The ozone became part of the irrigant flux that came from the units to the handpiece and of course to the working hands. The meaning of using the ozone in the irrigation system is managing the biofilm in a more advanced and proper way, and of course inducing a specific modification in the tissue inside the oral cavity in terms of increasing the effective and the precision of our treatment. So the new combination of the Mectron COMBI Touch and the Ozoactive can give us, as a clinician, something more in terms of treatment option. So we had an overview about the new version of Mectron COMBI Touch, And of course, we have a new handpiece for the piezo. We have more than 40 tips for the piezoelectric systems. We have new range for the tips. We have new tips from gold to metal. We have three different kind of terminal working hands for the air polishing section of the unit. We have dedicated powders for supra and for subgingival activity. We have different kind of source for irrigants. We have the possibility to combine together the mectron COMBI touch and the new Ozoactive ozone generator unit in order to enrich the irrigants also with the ozone. So we have several combinations that can help us as a clinician to perform our best and to provide to our patient the better and the best treatment as we can. And of course, we love the COMBI Touch by Mectron because we love prophylaxis.